Hello, German. I'm Abby from Respiratory Therapy. I'm here to do some suctioning. Should only take about 5 to 10 minutes and then I'll be out of your hair. Can I get a name and date of birth, please? Thank you. So we're here just to do some airway clearance to kind of help you feel less congested. I'm just going to place you in more of a Fowler's position, more proper. Before I do that, I'm just going to take your pulse, listen to your lung sounds. Can you take a deep breath in and out, in and out. This machine will check your O2 levels. Looks like we're doing good. Alright, so I got a pre-assessment done. I'm going to kind of set up my equipment here. I got my oxygen mask I'm going to hook up to the wall. And so I'm going to hook it up, and for about a minute I'm going to hyperoxygenate the patient. While that is going, I will set up my supplies. I have my suction kit. I have saline water, lubricants, and my suction. This is a sterile procedure, so I would put on the gloves. So this is my sterile hand. So it's been about a minute. We're done oxygenating the patient, so I can take that off. Beforehand, we are going to insert a nasal airway. I'm just going to size it up here from your nose to your ear. Going to lubricate it. And then I'm just going to have you take a deep, I'm just going to go in here and just need you to cough for me. Thank you. So we got that all finished. So then with my non-sterile hands, I have my suctioning hooked up. I'm going to get that untangled. Beforehand, we have an adult patient here, so I'll set it at like 130. Set it about 130 for suctioning. I can suction up some saline water to make sure that's properly working. I'm going to lubricate it. Alright, and if I can just have you, sterile hand, if I can just have you take some coughing for me. Perfect, should only take about 10 to 15 seconds. Go ahead and cough for me. There we go. So I can take that. And I'm just gonna hyperoxygenate you again for about 30 seconds. While you're doing that, I can suction up more saline to clear it out. Take my sputum sample if that was needed. Once I have that, I'll turn off the suction. I can dispose of everything properly. The patient is getting hyperoxygenated. Once that is finished, I'm going to reassess the patient, listen to their lung and breath sounds to see if there's any, if it sounds better. Check the pulse, oxygen levels. Going to, reposition the patient properly. If they had like a nasal cannula, I can put that back on, make sure there's correct liter flow. Do you need anything else? All right, thank you. I can go finish up with charting.